Friends, my name is Jesse. Welcome back as always to Male Nurse Mentor. Today, I got a little brief treat of a video. This one here is one I've been wanting to make for a while, and maybe it's one that you guys can relate to already. Maybe it's one you're not aware of quite yet. But either way, friends, it's a big concept that we're gonna learn in the nursing program, and it is understanding the most correct answer. What is the most correct answer? If you haven't heard this yet, you will, or you'll understand this idea eventually. But if you've heard about it, you can relate to this. This is what nursing school spends the majority of the time teaching you. Let's go. So friends, this concept here, the most correct answer, if it doesn't annoy you yet, it eventually will. But it's very, very, very important, especially when it comes to trying to become a nurse. It is the nursing foundation. It is the mindset that you're cultivating. It is the overall just thought process, the rationale process that nursing school spends 2 years, 2.5 years teaching you. And it is to understand that when a situation occurs, when a scenario happens, there's so many ways to approach it. There's so many correct answers. There's so many appropriate interventions. But the reality is, nursing school wants you to think of what is the most correct, which one is priority, which one would you do first. That is what nursing school makes you do. And towards the end of this video, I'll put in 2 very general, very basic examples, but the purpose to those is just to kind of get you to think a little bit about how this process ultimately works, right? And they'll probably be pretty easy questions for some of you. For some of you, maybe you haven't been exposed to this quite yet, but they're just 2 examples that I'll give you to give you an idea of what it is that I mean. But why is this important? Why do you need to learn the most correct answer? You need to learn the most correct answer. 1, to pass the nursing program, because you're gonna go through many quizzes, practical scenarios, homework assignments, all this stuff, right, in school, but also after school, right, when you're done with the program, the NCLEX. A big part of the NCLEX is asking you multiple choice questions. And multiple choice questions, friends, a lot of it is gonna be process of elimination. They're gonna give you 4 to 5 answers to choose from. Often on the NCLEX, they're gonna ask you, what would you do first? Which one would be priority? Which one is the most correct answer? And then you have to do process of elimination and kind of put yourself in the nursing mindset. The same nursing mindset nursing school spent 2 to 2.5 years teaching you how to think, right? And eliminate some. And eventually come up to the most correct intervention, the most appropriate answer, right? So apart from being beneficial for school, right, you kind of need to know this to make it through. And then the NCLEX, ultimately, to pass. The third reason, this is the thing that makes the biggest difference between a good nurse and a bad nurse, and a good nurse and a great nurse. The more fine-tuned you have this thought process of understanding the most appropriate answer, the most correct intervention, things like this, right? The more you understand this concept, the better of a nurse you'll be. Because this is the thing that when you go to call a doctor, you'll either make them happy or make them upset. Same thing with your colleagues. The colleagues will either see you as being a great nurse or a bad nurse, right? Especially when it's shift change and they're taking over your patients and they see that you actually weren't doing the right interventions. Like you were doing the right things, but you actually didn't do the one that was needed, right? Like it'll pop its head up at some point. And it's okay to have a certain level of anxiety around this, but just understand through the program itself, you'll cultivate this. And this is like a skill, but it's also this foundation of thinking like a nurse. It's like a good thing, right? It's also the same reason why nurses make the worst patients, they say, because you kind of know, right, kind of what's going on in the background. You know the most correct answer. You know this situation's fine, but to the average person, it may not be. It's little things like that as well that kind of pop up. But those are just random thoughts. I don't know why my mind went there, but it went there. But anyways, friends, I also wanted to add that some ways in which this is easier to understand, right? I'll just give you just general tips here. Knowledge from nursing books is a good one. The more you read into nursing books, the more knowledge you're gonna get. A lot of this most correct mindset, this nursing foundation mindset, comes from just general knowledge. So read those textbooks is a good way to do it. Intentional shadowing, right? Seeing those nurses in the hospitals during your clinical rotations, seeing how it is that they pull medication, see how it is that they work the IVs, getting little tips and tricks from them. That's a good way to get this knowledge, to also have that good solid nursing foundation, right? Experience in general. The more hours you're in clinicals, the more you read and follow up in class and hear professors and instructors speak about the nursing field, Those are all things that help. So it's normal to be a very new nursing student and not feel comfortable with this concept quite yet. Another one is just going over rationales for several different medical situations. This is often one of the best ways to get this nursing foundation, this concept under your belt. It's just speaking about scenarios. Oh, in this scenario, how would you handle it? Okay, well, what if this then happened? How would you handle it? Or what if this then happened? How would you handle that? And like I said, towards the end of the video, I'm gonna have like 2 just general examples of what it is that I mean. And then this next one that I have in terms of how to make this concept easier is just asking scenario style questions to the more experienced nurses. So it kind of goes hand in hand with the one I just said, but this one is kind of partly with asking experienced nurses from their experience. How would they handle this situation? How have they handled it? What have they seen from their experience? Things like that. So those are just general tips on how to make this an easier concept, an easier nursing foundation to kind of comprehend, but understand it takes time. Nursing school is 2 years, 2.5 years long, and that's about how long it takes. And even then, it's just to kind of pass the NCLEX. When you're in the workforce, you're also going to gain your own experience, right? From being in the workforce, you're now getting paid to do this. You do this every day. For some of us, it's 12 hours a day, 3 days a week. For some of us, it's 8 hours a day, 5 days a week. Those hours, that experience, it adds up. You're going to feel uncomfortable in certain situations, but you're going to learn from them. All that stuff helps with this concept. But coming out of nursing school, you're going to have a good general understanding of this most correct answer. And you kind of have to, because in order to pass the NCLEX, you need to have this pretty set. And you will. You know, I'm not trying to stress you guys out. You will, trust me. You may not feel it quite yet in your early semesters, but by your 5th semester, you're gonna feel good about this, trust me. So here, friends, I wanna give you just 2 different examples to think about as to what it is that I mean by this. And like I said, these are pretty basic, these are pretty general. It's just more to kind of spark the idea, just to kind of reinforce what it is that I'm trying to say here. So let's say in this first example, this is example 1, right? It starts as chest pain. Your first instinct as a student is gonna be to panic, right? Oh, chest pain, right? It's gonna instill a sense of panic, right? That's normal. Right? But first, as a nurse, you have to ask the patient and assess. Take that time to check in with them real quick. Ask and assess. Don't just jump into, oh, chest pain, cardiac, right? Don't do that. If you call the doc after a patient just says, well, I have chest pain, he's gonna ask you all these questions. And if you don't have the answer to these, he's gonna tell you to hang up the phone and go check the patient again. So when a patient, for example, says chest pain, don't automatically have inflicted panic. Ask the patient, do your assessment. Let's say after your assessment, you take your vitals, the vital signs are normal. Answers align with a heavy workout. The guy says, oh, I did 200 Navy SEALs. He just got done doing a very heavy workout, right? Is the picture that we're trying to paint here. A lot of chest movement, right? A lot of chest push-ups, burpees, right? He did a lot of muscular exercises to his chest, right? You also find out he's 22 years old, right? No history of cardiac history. None of that. So ultimately, based off your assessment now, when you go to call the doctor, from your assessment, right, your exam, be confident in it. It's more of a muscular pain in nature. The pain itself, when you palpate, it's a little sore, it's reproducible on his chest. So from that point on, now you call the doctor, hey doc, you know, and then they're not too worried about it. They may do an EKG just as a precautionary measure, but based on your assessment, kind of find out this isn't really cardiac related in nature, right? It doesn't present to be this way. And this is for me working in a prison. I see this all the time. 22-year-olds doing burpees, Navy SEALs, all this stuff. Oh, my chest is sore, it hurts. You kind of find out, it's not really cardiac. And I know this isn't a most correct answer, but if the question now asks, is this a cardiac type chest pain or like a muscular type chest pain? Chest pain isn't just chest pain. There are different types. From here, you now decipher it. It's not really cardiac, it's more muscular. So it's just this nursing foundation, this nursing mindset. So and then for this next example, this one's more of the kind of most correct instead of just the general nursing mindset. So for this one, right, example 2, let's say this same 22-year-old, right, stabbed in the lower abdomen and hemorrhaging profusely. When you arrive, he's not speaking or moving, right? Heard gasping for air. What is your first intervention, right? The options that I kind of wrote here are you take vital signs to assess blood pressure, you apply oxygen, you assess level of consciousness, you control the bleed, or you assess the airway. Which one would you do first? This is the one where technically none of these are inappropriate, right? These are all appropriate interventions. But when it comes to this scenario here, there's a most correct first intervention, right? And this is kind of that nursing mindset. Oftentimes you're gonna think of ABCs. They're gonna tell you a lot about this airway, breathing, circulation. But as you find out about this, there's so many different types. There's alert 911, there's bleeding and compression. That's also an ABC. And then you'll also hear CAB. This one's circulation, airway, breathing. So then it kind of continues to spark the question, what is the most appropriate one for this scenario? Sure, you can assess the airway. He's gasping for air. A part of that, you can also apply oxygen, right? Maybe you can assess the level of consciousness. You see he's kind of, he's like alert to like pain or something, some pain stimulation. And sure, you can take a blood pressure because it's probably really low. He might be going into shock, but that's probably also not something that matters right away. Right away, the best answer is to control the bleed, control the site. Don't let him lose any more blood. So in this scenario here, friends, you would go ahead and control the bleed. And this is just a very kind of basic example of the most correct answer. They're all correct. All these interventions are probably going to be needed in this situation. And because you would do that one first, that one is actually the most appropriate. And those are the type of questions that you will eventually see on the NCLEX throughout your nursing program. Those are the ones that get you to think. And when you speak about the rationales during these quizzes, right, that have these questions in your program, that is when you start to build up this nursing mindset. And it's really neat, right? All these things are going to help you in your future career. That'll help you be a better nurse, help you give better report, and overall a better job satisfaction because people will trust you. And it all takes time. All of this takes time. So it's okay if you don't have it, down pat now. I continue to still learn even today. I've gotten a good general knowledge now, but I mean, the learning experience is lifelong. There's always something more to learn. But anyways, friends, this was just a short, brief video on cultivating the nursing mindset of the most correct answer. I hope this was helpful, friends. I'm always here if you need me. You could find me in the DMs on Instagram or comment down below. I comment back to everybody. And as always, continue along in your nursing program. I wish you the very best of luck as you continue to move. I'll be here. I'm always around. Come find me.